The hypothalamus is a small portion of the brain that connects to the nervous system and is located behind the pituitary gland. It is responsible for certain metabolic processes and other activities of the autonomic nervous system. It secretes and synthesizes releasing hormones and, in turn, stimulates the secretion of pituitary hormones. Thyrotropin stimulates the production of the thyroid hormone, which in turn controls the cardiovascular system, brain development, muscle control, digestive health, and metabolism. Gonadotropin stimulates the release of hormones connected to the reproductive functions and puberty. Growth hormone controls growth and physical development in children as well as metabolism in adults. Corticotropin controls the body's response to physical and emotional stress, and it is responsible for suppressing the appetite and stimulating anxiety. The hypothalamus and pituitary glands are tightly integrated. Damage to the hypothalamus will impact the responsiveness and normal functioning of the pituitary. Hypothalamic disease may cause insufficient or inhibited signaling to the pituitary, leading to deficiencies of one or more of the following hormones: thyroid-stimulating hormone, adrenocorticotropic hormone, beta-endorphin, luteinizing hormone, follicle-stimulating hormone, and melanocyte-stimulating hormones. Treatment for hypopituitarism involves hormone replacement therapy. Neurogenic diabetes insipidus may occur due to low levels of ADH production from the hypothalamus. Insufficient levels of ADH result in increased thirst and urine output, and prolonged excessive urine excretion increases and the risk of dehydration rises. The thyroid gland is an auxiliary organ to the hypothalamus-pituitary system. Thyrotropin-releasing hormone produced by the hypothalamus signals to the pituitary to release thyroid-stimulating hormones, which stimulates the thyroid to secrete T4 and T3 thyroid hormones. Secondary hypothyroidism occurs when TSH secretion from the pituitary is impaired, whereas tertiary hypothyroidism is the deficiency or inhibition of THR. Thyroid hormones are responsible for metabolic activity. Insufficient production of the thyroid hormones result in suppressed metabolic activity and weight gain. Hypothalamic disease may therefore have implications for obesity. Growth hormone is another releasing factor secreted by the hypothalamus. GHRH stimulates the pituitary gland to secrete growth hormone, which has various effects on the body growth and sexual development. Insufficient GH production may cause poor somatic growth, precocious puberty, or gonadotropin deficiency, failure to initiate or complete puberty, and is often associated with rapid weight gain, low T4, and low levels of sex hormones.
The pituitary gland is a pea-sized structure located at the base of the brain just below the hypothalamus, to which it is attached with nerve fibers. It is part of the endocrine system and produces critical hormones, which are chemical substances that control various bodily functions. The pituitary is divided into 3 sections: the anterior, intermediate, and posterior lobes. The anterior lobe is mainly involved in development of the body, sexual maturation, and reproduction. Hormones produced by the anterior lobe regulate growth and stimulate the adrenal and thyroid glands, as well as the ovaries and testes. It also generates prolactin, which enables new mothers to produce milk. The intermediate lobe of the pituitary gland releases a hormone that stimulates the melanocytes, cells which control pigmentation, like skin color, through the production of melanin. And the posterior lobe. It produces antidiuretics hormone, which reclaims water from the kidneys and conserves it in the bloodstream to prevent dehydration. Oxytocin is also produced by the posterior lobe, aiding in uterine contractions during childbirth and stimulating the production and release of milk. So as we can see, the pituitary gland is very active in mothering. The 2 sections of the pituitary gland that produce hormones are the anterior and the posterior. These 2 sections of the pituitary gland produce a number of different hormones which act on different target glands or cells. The anterior pituitary produces adrenocorticotropic hormone, and the abbreviation for it is ACTH. It also produces thyroid stimulating hormone, which is abbreviated to TSH. Next is the luteinizing hormone, and that is abbreviated to LH. Then it's the follicle stimulating hormone, which is FSH, and prolactin, which is PRL. Then we have the growth hormone, which is, of course, GH. And then last for the anterior is the melanocyte stimulating hormone, which is abbreviated to MSH. And now for the posterior pituitary. And it only has two hormones, and only one of them has an abbreviation. And the first one is antidiuretic hormone, which is abbreviated to ADH. And then it also has the oxytocin hormone, and it has no abbreviation. The adrenocorticotropic hormone stimulates the adrenal glands to secrete steroid hormones, principally cortisol. The growth hormone regulates growth, metabolism, and body composition. The luteinizing hormone and follicle stimulating hormone act on the ovaries and testes to stimulate sex hormone production and egg and sperm maturity. Prolactin stimulates milk production. Thyroid stimulating hormone stimulates the thyroid gland to secrete thyroid hormones. The antidiuretic hormone controls water balance and blood pressure. It is made by the hypothalamus, but is stored in the posterior pituitary gland prior to being released into the bloodstream. Oxytocin stimulates uterine contractions during labor and milk secretion during breastfeeding. It is made by the hypothalamus, but is stored in the posterior pituitary gland prior to being released into the bloodstream. So that is a neat thing. There, of course, are things that could go wrong with the pituitary gland, such as conditions that cause the pituitary gland to produce too much of one or more hormones, like acromegaly, Cushing's disease, and prolactinoma. And there can also be thyroid tumors, which are involved with the pituitary system. And then there are conditions that cause the pituitary gland to produce too little of one or more hormone. Examples include adult growth hormone deficiency, diabetes insipidus, or hypopituitarism. And there are conditions that alter the size and or shape of the pituitary gland, including empty sella syndrome. And then also there is a cell type that may divide and then form a small benign lump known as a tumor, and the patient may then suffer from the effects of too much of the hormone the cell produces. If the tumor grows very large, even though it is still considered benign, it may squash the surrounding cells and stop them from working. That is called hypopituitarism.
The thyroid sits low on the front of the neck, below your Adam's apple, along the front of the windpipe. The thyroid releases triiodothyronine, or T3, and thyroxine, T4, and thyroid stimulating hormone, TSH. T3 and T4 are made by TSH, which comes from the pituitary gland. 20% is T3, and it's the most effective, and the other 80% is T4. The thyroid's main purpose is the regulation of metabolism, and it plays a role in virtually every important bodily function. T3 increases the basal metabolic rate and thus increases the body's oxygen and energy consumption. The basal metabolic rate is the minimal caloric requirement needed to sustain life in a resting individual. T3 acts on the majority of tissues within the body, with a few exceptions including the spleen and testes. It increases the production of the sodium-potassium ATPase, which normally constitutes a substantial fraction of total cellular ATP expenditure, without disrupting transmembrane ion balance, and in general increases the turnover of different endogenous macromolecules by increasing their synthesis and degradation. The addition of triiodothyronine is one of the most widely studied strategies for refractory depression. However, success may depend on the dosage of T3. Triiodothyronine is also used as an ingredient in certain over-the-counter fat loss supplements designed for bodybuilding. Several studies have shown that these compounds increase the metabolization of fatty acids and the burning of adipose fat tissue in rats. Triiodothyronine has also been used to treat Wilson's syndrome, an alternative medical diagnosis not recognized as a medical condition by mainstream medicine. This diagnosis involves various non-specific syndromes that are attributed to the thyroid, despite normal thyroid function tests. The American Thyroid Association has raised concern that the prescribed treatment with triiodothyronine is potentially harmful. Long story short, the thyroid is important because it does stuff for us. And without the stuff that it does, we would not be able to achieve the tasks and things and stuff of sorts that we do every day. When I say thigh, you say roid. Thigh. Did you say it?
Today I'm going to talk about the adrenal glands. They are located on top of each kidney. Each adrenal gland is comprised of two distinct structures, the inner part and the outer part. The outer part of the adrenal gland is called the adrenal cortex, and the inner region is known as the adrenal medulla. The adrenal cortex produces three hormones.
The three hormones are the mineralocorticoids, the glucocorticoids, which are predominantly cortisol, and the adrenal androgens, which are the male sex hormones, which are mainly DHEA and testosterone. The adrenal cortex, which is the outer part of the gland, produces hormones that are vital to life, such as cortisol. Cortisol helps regulate metabolism and helps your body respond to stress. And aldosterone, which helps control blood pressure. There are many diseases for the adrenal glands, such as Cushing's syndrome, which can include upper body obesity, round face and neck, and thinnings of the arms and legs. There's also Addison's disease, which is a disorder in which the adrenal glands do not produce enough hormones. Next is adrenal insufficiency, which is exactly the same as Addison's disease. And then there is an adrenal tumor. There are many different ways to treat the diseases. The ways to treat the disease is one, you can have surgery to remove tumors in the adrenal gland, or, when appropriate, surgery to remove the one or both of the adrenal glands. Another is medication to stop the excess production of hormones. Another one is also just hormone replacement. Then, after the hormone replacement,
You can do things to reduce adrenal fatigue stress. 1 is rest when you feel tired as much as possible. 2 is sleep 8 to 10 hours a night. 3 is avoid staying up late and stay on a regular sleep cycle, ideally in bed before 10 p.m. 4 is laugh and do something fun every day. Next is minimize work and relational stress. And then eat on a regular food cycle and reduce your caffeine and sugar addiction. 7 is exercise. Even moderate exercise and walking can help. 8, avoid negative people and negative self-talk. And 9, take time for yourself, do something relaxing. And 10, seek counsel or support for any traumatic experiences.
That's all, folks.
Hello, welcome to my video about the gonads. The gonads are the sex gland or the reproductive gland in both males and females, which produce sex cells and sex hormones. In the female, it is the ovaries that produce the egg cells, and in the male, it is the testicles that produce the sperm. Now, the gonads are located near or at the lower abdomen. The ovaries are actually located in the lower abdomen. The testes hang outside of the pelvis below the lower abdomen. Testes produce sperm and one kind of hormone called testosterone. The ovaries produce two groups of sex hormones, progesterone and estrogen. There are actually three major estrogens known as estradiol, estrone, and estriol. Testosterone is responsible for the development of male sexual characteristics, such as growing in body height, growing more hair, and other stuff. Progesterone is necessary for the implantation of fertilized eggs in the uterus and for maintaining pregnancy. And estrogen is a hormone that plays an essential role in the growth and development of females' sexual characteristics, such as breasts, pubic and armpit hair, endometrium, and the regulation of menstrual cycles and reproductive systems. Now, there are a lot of diseases for the different gonads, but here are some of the more prominent ones that I found. First one is testicular cancer, and like any cancer, it happens when the cells of the testicles develop mutations that cause them to misbehave or multiply recklessly and just invade other places where they should not be. This process usually creates a slow-growing, painless lump or firmness on one testicle. Testicular cancer is treated according to the type of cancer and how far it has spread. Cancer that has not spread from the testicle or has not spread to other parts of the body can be cured with oreectomy, which is a surgery to remove the testicle. If it is spread outside of the testicle, testicular cancer treatments may include surgery to remove the abdominal lymph nodes, chemotherapy, radiation therapy, or a combination of the three. Another disorder of the testicles is testicular torsion, and when that happens, twisted kinks develop in the testicle's blood vessels, kind of like a garden hose. If this treatment is delayed, the testicle can die. Emergency surgery is required to untwist the testicle and prevent it from happening again. During surgery, the other side is usually fixed, as it tends to happen a second time in the future. Now for some diseases of the ovaries. Ovarian cysts are closed, sac-like structures within the ovaries that are filled with liquid or semi-liquid substances. Ovarian cysts may not show any symptoms, but larger ones can show pain in the abdomen, pelvis, or low back, feeling of bloated or indigestion, increased abdominal girth, feeling an urge to have a bowel movement or having difficulty, painful bowel movements, pain during sexual intercourse, pain in the lower right or left quadrant of the abdomen on one side, and nausea and vomiting. Most ovarian cysts are diagnosed with ultrasounds or physical examinations. Transvaginal ultrasound is the most common way to examine and find ovarian cysts. The treatment for these cysts depends upon the cause of the cyst and varies from observation and monitoring to surgical treatment. The final disease I have to talk about is polycystic ovarian syndrome, or PCOS. It is a common endocrine system disorder among women of reproductive age. Women with PCOS have enlarged ovaries that contain small collections of fluids located in each ovary, which can be seen during an ultrasound exam. Some symptoms of PCOS are infrequent or prolonged menstrual periods, excessive hair growth, acne, and obesity. In adolescents, infrequent or absent menstruation can raise suspicion about this condition and should definitely have it checked out. Well, thank you for listening to my video. I hope you enjoyed it, and if you didn't, I'm sorry. Enjoy the rest of your day, and I'll talk to you guys in the next video.
Parathyroid glands are located behind the thyroid gland and control the amount of calcium in our blood and bones. About 1 in 100 people develop a parathyroid gland tumor during their lifetime, causing parathyroid disease called hypoparathyroidism. Hyperparathyroidism is a destructive disease that causes high blood calcium, which leads to serious health problems, even early death. It can be cured in most patients in less than 20 minutes by surgically removing the parathyroid tumor. The 4 parathyroid glands make more or less parathyroid hormone, or PTH, in response to the level of calcium in the blood. When the calcium in our blood goes too low, the parathyroid glands make more PTH. Increased PTH causes the body to put more calcium into the blood. Increased PTH causes the bones to release their calcium into the blood. When the calcium in our blood goes too high, normal parathyroid glands stop making PTH. They shut down. Calcium is the most important element for the nervous system, the muscular system, and the skeletal system. Calcium provides the electrical system for our nerves and muscles, allowing the nerves to conduct electricity and the muscles to contract. This is why parathyroid disease, overproduction of PTH from a parathyroid tumor leading to high blood calcium, causes symptoms of the brain, muscle, and bones. And here now we have some parathyroid function facts. The parathyroid glands monitor the calcium in the blood 24 hours per day, and people with normal parathyroid glands have calcium levels that jump around very little or never. It almost stays the same number in the 9s. People with bad parathyroid glands, which is hyperparathyroidism, have grown a tumor in one of their parathyroid glands that has lost its regulatory system, so the calcium levels jump around all over the place, usually being high, around a 10.2. It is never normal to have high calcium levels. Adults over the age of 30 should have almost every calcium level be 10.1 or lower. Adults over the age of 40 who have persistent calcium levels above 10.1 almost certainly have a parathyroid tumor. High calcium levels almost 100% of the time mean you have a tumor on one of your parathyroid glands. These are not cancerous tumors. Instead, they cause trouble within the brain, the muscular system, and the skeletal system. People don't like having high calcium. It makes them feel bad, ruins their kidneys, liver, and arteries, causes strokes and cardiac rhythm problems, causes kidney stones and osteoporosis, and can even increase the risk of cancer. If you have hyperparathyroidism, a bad parathyroid gland, you should get it removed. You will live longer and feel better. Humans don't like high calcium. If your lab test says that having calcium levels up to 10.4 or even 10.6 are normal, then that lab is including children and teenagers into the normal range. It is normal for children and teenagers to have a blood calcium levels up to 10.4 or even 10.5 on occasion. It is normal for young adults in their 20s to have calcium levels up to 10.3 or 10.4. Once you are over 40, it is okay to have an occasional calcium level up to 10.2, but not anything above. If you're over 40, then it's not normal to have frequent or persistent calcium levels above 10.1. If your doctor says that it is okay for you because the lab value says this is okay, then you tell them not true. That normal range includes kids, and that is not normal range for adults over 40. If you're over 40 and have persistent calcium levels above 10.1, then you need to ask about being tested for hypoparathyroidism.
The pancreas is about 6 inches long and sits across the back of the abdomen, behind the stomach. The head of the pancreas is on the right side of the abdomen and is connected to the duodenum, the first section of the small intestine, through a small tube called the pancreatic duct. The pancreas produces two hormones to control blood sugar. They are glucagon and insulin. The alpha cells of the pancreas produce glycogen. Glycogen raises blood glucose levels by stimulating the liver to metabolize glycogen into glucose molecules and to release glucose into the blood. Insulin is secreted by the beta cells of the pancreas. The stimulus for insulin secretion is high blood glucose. Glucogen is secreted by the alpha cells of the pancreatic islet in much the same manner as insulin. The pancreas releases glycogen when the concentration of glucose in the bloodstream falls too low. Glycogen causes the liver to convert stored glycogen into glucose, which is released into the bloodstream. High blood glucose levels, on the other hand, stimulates the release of insulin. The pancreas can have many diseases. The main ones are type 1 and type 2 diabetes. The other is cystic fibrosis. There is not a real cure to diabetes. You can take insulin injections or use an insulin pump. Things to help it will be eating a healthy diet, regular physical activity, and not smoking. Really, all you can do for cystic fibrosis is your doctor can prescribe antibiotics.
To do an injection, you will need an insulin pen, enough insulin for the dose, a new pen needle, cotton wool or a tissue. To prepare your pen, attach a new needle onto it. Perform an air shot to clear any air out of the needle. You should see a steady, unbroken stream. Find a soft, fatty area to inject into. The best areas include the thighs, the belly, the bum, and the upper arm. The upper arm may not be recommended for people who only have a small amount of fat. Dial the dose needed. Here I'm going to put in 5 units of insulin. Take a fold of flesh. Try to find a region that isn't tough or lumpy. Put the needle in. Push the plunger slowly. Hold the needle in for about 10 seconds to prevent any insulin from escaping. If any blood and or insulin escapes, wipe the skin with a cotton wool or tissue. When you're done, remove the needle and put it into a sharps disposal bin.
The pineal gland, or epiphyse, synthesizes and secretes melatonin, a structurally simple hormone that communicates information about environmental lighting to various parts of the body. Ultimately, melatonin has the ability to entrain biological rhythms and has important effects on the reproductive function of many animals. The light transducing ability of the pineal gland, has led some to call the pineal the third eye. The pineal gland is a small organ shaped like a pine cone, hence the name. It is located on the midline, attached to the posterior end of the roof of the third ventricle of the brain. The pineal varies in size among species. In humans, it is roughly 1 centimeter in length, whereas in dogs, it is about 1 millimeter long. To observe the pineal, reflect the cerebral hemispheres laterally and look for a small grayish bump in front of the cerebellum. Melatonin is produced in the pineal gland. Melatonin plays a key role in the sleep-wake cycle of the body's response to sunlight. It's located near to the center of the brain, between the two hemispheres, tucked into a groove where it is rounded, where the two rounded thalamic bodies join. Unlike much of the rest of the brain, the pineal gland is not isolated from the body by the blood-brain barrier system. It is a reddish-gray and about the size of a pea. It's shaped like a tiny pine cone, like previously said. Now, what does melatonin do? It controls our sleep cycle, helps with the reproductive system. The disorder of the pineal gland is associated with depression, peptic ulcers, and sexual dysfunction. Depression, peptic ulcers, and sexual dysfunction may be exacerbated by a deficiency of melatonin. Stress and dietary habits may lead to deficiencies of both serotonin and melatonin. Melatonin inhibits the release of control via the release of vasopressin. Abnormal circuit rhythms of cortisol may occur in states of diseased melatonin. A circadian rhythm of melatonin has troughs associated with peaks of the incidence of peptic ulcers and psychotic depression. Psychotic depression is an apparent disorder of the locus coeruleus and or dorsal raphe Biological nucleus. Effects of melatonin. Melatonin has important effects in integrating photoperiod and affecting circadian rhythms. Consequently, it has been reported to have significant effects on reproduction, sleep-wake cycles, and other phenomena showing circadian rhythm. Effects of the reproductive function would include seasonal changes in day length, have profound effects on reproduction in many species, and melatonin is a key player in controlling such events. In temperate climates, animals like hamsters, horses, and sheep have distinct breeding season. During the non-breeding season, the gonads become inactive, but as the breeding season approaches, the gonads have been rejuvenated. Thank you for watching this informative video of the pineal gland.